Hi, this is Nick Despotidis. I'm here with Paul Levine. We're answering your most difficult practice management questions. Paul, thank you so much for joining me this morning so we could get through these questions and answer them, because we selected the ones that we felt could benefit the membership the most. Thank you, Paul.
Hi, Nick. Thanks for having me, Nick. I appreciate the opportunity to chat with you and also with our members to answer some of these questions. So again, thank you for inviting me to do this.
Well, thank you, Paul. Our question right now comes from Monika Spoka. She's very enthusiastic. I emailed her. I said, hey, would you mind recording your question? She was very kind to do so, very enthusiastically. So let's play that.
So I'd like for you to discuss on how to handle non-adapts. In our practice, the way we have it set up, where a new patient starting Ortho-K program pays for a 1-year program. In that program, the contact lenses are included. Also, the appointments for all the year's worth of follow-ups. In some cases, patients are unable to wear contact lenses for whatever reason. We will try to troubleshoot and see if we can get them to wear contacts, but there are some situations that they drop out. I would like for you to discuss on how you handle the financial aspect of that, and also maybe some of the ideas on how to put that in the contract so they know ahead of time should that occur. What do you offer instead? Thank you.
Thank you, Monika. You want to give it a try, Paul?
Yeah, sure. I mean, I don't know that there's ever one right answer to any of these questions, to be honest.
Yeah,
and all of our practices are different. Our demographics are different. Our patients are different. But I can tell you, in our office, what we have in our contract is that if for any reason if a patient decides to drop out of the program within 90 days of that initial dispense, then we'll refund what they paid minus a $750 holdback fee to cover our material costs.
Yeah, we do something very similar, Paul. Is we give them back all their money except about 2/3, and we put that in the contract when they sign it. If you have any issues within the first 3 months, and sometimes I extend it. Some kids take 3 months just to learn to put the lenses in. It's just the way the game is played, and I just want the parent to know this is goodwill. Look, I'm going to extend that to 6 months. My goal is not to refund your money. My goal is to fit your child. So, Monika, it's pretty straightforward. You put in your contract. You come up with a fee with your staff where you'd feel comfortable keeping for your time and effort. But I really do think I want to help you a little further on this. That's why I chose your question. We used to get this a lot meaning about 3 to 4 times a year. For our practice, that was a lot. Right now, I can't remember when I cut a refund check. So we got a lot better at finding out when these kids wanted to drop out, or adults. The number one thing is we do a consultation. Paul, do you do a consultation? Or do you fit them in the exam during the exam?
No, well, it depends. A lot of times it's a separate consultation.
Yeah, we used to do it during the exam. I don't do it anymore. I spend an hour.
I don't have enough time. Yeah, there's no time to take all the maps and too much discussion.
Yeah, not only that, I got to tell you, on the other end, I could predict a dropout before they occur. That's why I use atropine, like we discussed in a previous episode. Is if it's an adult, I don't take adults anymore. Ivan still does, because man, oh man, that's just a wild card. But if I see that the child's not ready or the parent's not ready, I make that determination at the consult. We also adjust our fees, going back to earlier questions, and one coming up is that we adjust our fees if this parent or patient is going to take a lot of time. What we basically do is Monika, we handhold them from the INR to that same night, to the next day, to the day after, to Saturday, to Sunday. Someone is calling them or emailing them, because I know that first week is when they get the buyer's remorse, when everybody wants to quit, including my staff. So I would say tighten up your systems, but sit down with your staff and find out there's a pattern there. I promise you. When are they dropping out? And the answer to that is, I'm going to adjust my fees to allow me to hold this patient's hand. So when I started this 20 years ago, I swear to you, I would call patients on a Sunday, on a Saturday. That was marketing, but it was also like I can't handle all these questions in my exam chair. So basically, I'd get on the phone and I'd spend 20 minutes talking to the child, talking to the parent, and my dropouts have really basically come to zero. So I know you could do the same thing. It's just adjusting your fees to allow you and or your staff member to hold the patient's hand for the first 3 months. After that, you will start fitting them better because, you know, there's a fitting component, but the harder aspect is the patient hand-holding component. And I think those dropouts will dissipate or slowly go away. So that's how I'd answer your question, Monika. Thanks so much for submitting it. I appreciate it.